Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Associate Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life.
And today we're joined by Sarah Shaw, Senior Manager of BIPOC, that's Black, Indigenous, People of Color Outreach at GHLF. And she's here to talk about Black History Month things with us and get into the health disparities of it all and what we can do to help raise the voices in communities of color. But first, we do have a few news updates.
Yes. So this week, we're early February, the opening offers on Medicare price negotiations are beginning. This stems from the Inflation Reduction Act, which passed Congress and was signed into law in late 2022. And the U.S. Department of Health and Human Services, HHS, through its Centers for Medicare and Medicaid Services, CMS, sent initial offers to the participating drug companies of the first 10 prescription drugs selected for negotiation in the first cycle of the Medicare drug price negotiation program. That was a mouthful.
Yeah, well, this is kind of like the first key step after they announced the 10 drugs. I don't think anything has happened yet, really. So this is the first step in actually getting to that negotiated price, right?
Correct. So the negotiations have begun. So each drug maker now has until early March to accept the offer or to propose a counteroffer to the government. And then a series of negotiation sessions could follow, with the process set to conclude by August.
And then once the price is agreed upon, it'll take place in 2026.
Correct, which is, by my calculations, 2 years away. So 2 years, and we've still yet to see how this is going to impact the prices that patients themselves directly pay. So what we'll see.
That's really important to stay on the lookout for.
Yes. Another important issue is the Supreme Court has agreed to take up a case on COVID misinformation.
Yeah, we've talked a lot about the misinformation on social media during COVID, whether it was about vaccine safety, mask effectiveness, COVID's origins, and the shutdowns that happened. And Biden officials had urged platforms to pull down posts and delete accounts and amplify correct information. And now the Supreme Court is going to decide if that violated First Amendment rights.
Yeah, fascinating to watch. I'm a lawyer, and I'd say it's difficult to go to law school without having some kind of an interest, at least, if not an affinity for the First Amendment. Those cases were always a little more interesting than your contract law classes. So this is a big First Amendment case.
So just from that perspective, Stephen, what do you think is likely to come out of this?
I'm going to plead very loyally.
I knew that was coming.
Actually, no, in true ignorance, though. I honestly have not read the filings, so I don't want to misstate anything. I'll tell you this. I promised to do the research and read, but it is interesting. There's a balancing act. There's not an unlimited right to free speech, as we all know. You can't yell crap fire in a crowded movie theater is probably the most prominent example of that. Government has a compelling interest in curtailing certain forms of speech. And when public health is involved, when we're talking about misinformation, there's also the issue, it gets even trickier because these social media sites are not necessarily the ones that are posting. It's individuals who are posting onto these social media sites some of the misleading information. I say misleading, let's be a little more real and say outright lies about vaccine safety, etc.
Well, regardless of what the outcome is, it will, though, have major implications for what role that public health officials can play in the spreading of information on social media.
Totally. By the way, we should mention the case is called Murthy versus Missouri. And it alleges that federal officials coerced social media and search engine giants like Facebook, Twitter, YouTube, and Google to remove or to downgrade posts that question vaccine safety, COVID's origins, or shutdown measures. And the Department of Justice lawyers argue that officials made the requests, but never actually forced the companies to do this.
Well, as we said, arguments are set to come March, so next month. So it looks like we'll have some updates soon.
Yeah, and my nerdy lawyerliness is definitely excited. I'll say that much. But let's move on to our topic of the day, an important topic for us here at GHLF. We spend a lot of time talking about health equity and also the interplay of race and public health outcomes. And it's February, it's Black History Month. So we're excited to bring on Sarah and talk a little bit about some of the work that we are doing at GHLF and some of the importance of Black History Month generally, even outside of GHLF.
Yeah, welcome back, Sarah. It's been a while since we've had you on, but our listeners should remember you because you've been here before. How are you?
Yeah, feels like I've stepped into a home again. Coming back, I always enjoy talking with you and Steven about anything that's going on. So honored to be here today.
So, why don't you take a minute if we have any new listeners to introduce yourself and your role at GHLF?
Sure. So my name is Sarah. I'm the BIPOC Community Outreach Manager at GHLF. A lot of what I do centers and amplifies the voices of BIPOC patients within our communities, making sure that they have a megaphone to get their experiences and needs kind of heard throughout all of the work that we do, the various projects. I also am a person that lives with a few chronic illnesses myself, such as migraine, and I help run patient councils and am involved in a lot of work regarding to asthma, IBD, dermatology, cancer, and migraine and arthritis as well. So happy to be here on the show.
And I think you just highlighted something really important about just mentioning all the diseases and the fact that these issues span across diseases. A lot of what we're going to talk about today with health disparities and racism in healthcare and social determinants of health, it's not just one disease. It really does span across the patient journey.
Absolutely. It's something that I think, in terms of I'm talking about the Black community, we already know that there are health disparities in terms of just in general BIPOC patients going to the doctor, not having trust in the system. And so having these conversations and having us dedicate time to health equity is what's going to help bridge that gap to ensure that it's equitable across all communities, not just BIPOC, but just in general. So it's really important, the work that we're doing, and hoping that it impacts patients in a positive way.
Can you give for our listeners some examples of the burden of chronic disease and its disproportionate impact on the Black community?
Absolutely. This is a really good question. I know I can start off with COVID. When
Mm.
2020 hit, it was a hard time across all patient communities, but it especially hit really hard for Black and Brown communities. I think the statistic was Black and Brown communities were hit 3 times more with COVID illnesses versus their white counterparts. And I think a lot of the marketing that was done to kind of help that in terms of engaging people to go get vaccinated, to help those disparities, but it is still an ongoing process. I think a couple other things that come to mind is regarding dermatology, specifically psoriasis and eczema present differently on darker skin tones. And so for the patients that we work with that have darker skin tones, Black or Brown communities, there's been a lot of misdiagnosis for them, and their chronic pain or chronic illness journey takes much longer to get a diagnosis. So doctors specifically have not been trained to recognize the differences of what psoriasis or eczema looks like on darker skin. So it's just a matter of implementing that in medical school, to have examples, to have people show that. Because I think back to a patient that we work with very well. She's a wonderful woman, Diane Talbert, and her story specifically of trying to get a diagnosis for years of where people just thought she was contagious, when in fact we know psoriasis is not contagious. It's an autoimmune disease inside the body, but it took her a very long time to get a diagnosis. Those two things are front in mind, and then cancer as well. Cancer, lupus, and sickle cell, it definitely affects Black communities a lot harder than our white counterparts.
Sarah, it's interesting you bring up about how psoriasis appears differently on skin of color. I actually was just reading, and I put it in our outline here, this research study published in Arthritis Care and Research, and it was about fixing the education gap for assessing lesions in lupus patients of color. And like you mentioned, Black patients have a 3 to 5 fold increase of incidence of lupus versus their white patients, but they're often completely absent from training materials in medical school or residency. Doctors are just not seeing what these lesions look like on patients of color, exactly as you said. So, to address this, a group of researchers had created this interactive tool that included over 100 images from patients of color. And following the training module, there was a significant improvement among providers in being able to identify these lesions among patients. And they surveyed them, and they were able to describe the rashes, and they were much more confident in diagnosing the patients. And it's just wild to me that something as simple as including images can really make such a difference for improving that time to diagnosis, improving access to treatments, because the sooner diagnosed, the sooner you're getting on treatments, and that there's just really simple ways we can address this like systemic racism that's in our healthcare system.
Absolutely. Even some things that are very old school still being taught in medical school. black skin is thicker than white skin. We know that that is not accurate, but until we can have that corrected from the beginning to when we're bringing people in to training, to be doctors, to be physicians, to be nurses, that it needs to be auto-corrected from the beginning so that those stereotypes are not implemented. And speaking of like medical school, an article that I wrote, which I'll drop at the end, is I found that in the US specifically, only 5.7% of doctors are Black. And this is important for me to bring up in general, just because of the mistrust that the Black community has in healthcare in general. Being able to see a doctor that reflects like your background, your ethnicity is a huge way to help bridge those healthcare disparities. They're more likely to go to the doctor if they see someone that looks like them. And just seeing that number be so low is a reason why we still have these disparities. So everything that we can do to make medical school and just different things that are related to healthcare more diverse is going to help fix those problems.
And can you talk about in your journey, you mentioned you have migraine and other chronic diseases. Did you have trouble finding a provider of color? What was it like when you found one? Has it been helpful? Like, tell us everything about that or give us a synopsis because we could probably do another 10 episodes on that.
I'll try and do the abridged version. I ramble, but I will try my best to keep it centered. So I appreciate you asking me that, Zoe, because I did not have a very good relationship with healthcare when I was younger or growing up. There was a lot that happened where I was told I was making things up. It was all in my head when I was younger. Oh, these are just growing pains. She's doing this for attention. And I just have to say something here. I'm also a transracial adoptee. So I was raised in a white family. And so I had my dad, when I was younger, advocating along there with me. And when he unfortunately passed away, that's when I started to notice a lot more mistreatment in terms of specifically with migraine. There was certain comments made to me about how, oh, you don't cry like my other patients when they're getting injections, or where am I going to find all your head under all this hair when I was getting injections
Oh my
for
gosh.
migraine treatment. And it's just for me, I didn't speak up. And I think I was so early on in my patient journey that I didn't know that like I could have a voice in those doctor's appointments. And so for me, I left. I moved away. I specifically dedicated a lot of time and energy to find providers that looked like me. And it took a while. It's not easy. And I also have to say I have a lot of privilege. I have good health care. And I know some people are in these deserts in America, not literal deserts, where they have to travel very, very far to find doctors that look like them. And sometimes they have to just work with what they have. For me, in my situation, I have a car, I have a partner who can drive me to my appointments that are about an hour and a half away. And that's where I see my queer and Black neurologists who I have a wonderful relationship with. We have good back and forth in terms of shared decision making when it comes to my disease. And then in terms of mental health, what I think is so important because we know mental health is something that impacts the entire patient community, specifically the Black community. We need more mental health tools and resources. And for me, it was very important where I had therapists in the past that were white. There were just certain things that couldn't be addressed in terms of racism or chronic pain. And I was very intentional in my search. I think 2.5 years ago, I think I've been seeing my therapist for 2 years, and it's made a world of difference of just having someone who understands or where you feel safe and can go about when we code switch and stuff like that. And it's made a tremendous impact on not just my physical health, but my mental health of not having to worry, am I going to get shot down by another doctor, or am I going to have to deal with a microaggression at the doctor's office? And those are just two examples. And that's honestly what I want for all patients in general. I want them to have wonderful relationships with their doctors, with their physicians, because not going to the doctor when you have a chronic illness, it's tough and it will make us sicker if we can't put our health first. And I'll end it really soon. I think another caveat for a lot of BIPOC patients is not having time to prioritize our health, where usually a lot of other things come first: family, raising kids, juggling multiple jobs, and not having accessible hours for patients to be able to take time, whether it's the morning, whether it's on the weekend, whether it's late at night. I do know that I've spoken with quite a few Black patients where they're like, I don't have the time because I don't have a flexible schedule to be able to go to the doctor. And then another access issue too is affordability for treatments. And I think that was a big part of my journey. But also, I got to a point where I was like, I need to make this better, not just for me, but for all patients. And so that's why I do what I do here.
Yeah, that's very well said. I'm just thinking out loud. It's what you're saying. A lot of it is it's tough to say like this, but it's just the act of doing it on the individual level. I mean, first of all, we're talking about so many things, and I'm putting aside the systemic racism in healthcare. I'm putting aside some of the social determinants of health for now, but I'm talking specifically about the access issues that you're describing, and I'm going to even put aside the global access issues to talk on the individual level. Just the act of getting yourself to the doctor, advocating for yourself, advocating to try and find a provider that has hours that you can get to in your care, advocating to obtain needed health insurance, whether it's Medicaid or private insurance through an employer or through the Affordable Care Act exchanges. It's daunting, to say the least, but I think the three of us can agree that the more you do it, the less daunting it becomes. Is that a fair? I hope that's a fair statement, right? Which is the one advantage those of us, the three of us who are chronically ill, have, is that unfortunately we have experience going to doctors' offices. I don't know. I have a degree in navigating the healthcare system, whatever that degree is.
The ups and downs of the ins and outs that able-bodied people don't understand until it happens to them. Even me, before I was diagnosed with chronic migraine and endometriosis, it was an eye-opener into how our healthcare system works and all of the access issues that are riddled throughout. And I think we're moving the needle forward, but there's always more to do.
Yeah, yeah. And I'm sorry to be so pessimistic, but I'm being realistic in saying there's no one that's ever going to be a better advocate for your own healthcare than you are, or potentially a loved one who's, helped take control. But let's talk about more on the global scale, reducing disparities and looking to a brighter future but when we have you back on the podcast in 10 years, in 20 years, how are we going to get there? How are we going to reduce these disparities?
My first and foremost thing is just together. Together. I think a lot of burden falls on patients. And you're right, Stephen. Sometimes the best advocate for your health is you. You know your body inside and out. But I do think that there are ways that medical schools, physicians, patient advocacy organizations like ours who are able to represent and amplify and center patient voices that typically do not get heard, and sharing that back with pharmaceutical companies to make sure that the patient voice is embedded through every aspect of what we're doing. I know there's also a talk about clinical trials, making sure that there's diverse patients in clinical trials. And it's just going to take a group effort. And I think we're on the right page. But my equitable future dream is just all of us working together to make sure no person is not getting healthcare due to access issues. That's my dream.
I think just to bounce off that, it's important to be an advocate for yourself. Once you have attained that level of being able to advocate for yourself or as a caregiver for a loved one, the next step is to advocate for others, and which is what we do here and what all of our patients, and particularly our 50 state network patients, do, is to advocate for a better world.
You mentioned caregivers. I have to give a shout out to my partner, Tara, who comes with me on almost every single one of my doctor's appointments for that extra support and remembering things that I forget. Just having that extra support to know that you're not advocating alone is a lot, or even having you prep with your loved one or partner before you go to your appointment is effective. That's all I wanted to say about that.
And I was just going to add that, of course, we do awareness all year long, but having a month like Black History Month really provides a dedicated time where you can go and listen and learn about people's stories and then think about ways you can get involved, like Stephen and Sarah are saying, and advocate. But I think it's really a great opportunity to just sometimes take a step back and learn and hear what conversations are happening outside of your traditional community, and go on social media and see what people are talking about. Send this podcast to a friend, hear what Sarah has to say. But I think it's really important, especially as a privileged cisgendered white person, to just like sit back and listen to the voices of the community.
And what you said is very powerful, Zoe. I think with Black History Month, in terms of what it means to me, it's a time for our allies to listen and not center themselves like during these conversations where it's sometimes very vulnerable for us to share and be open, because some of these things involve medical trauma, medical PTSD, and listening and then offering, how can I help you? Whether that's just as simple as you said, sharing their article, sharing their podcast story, offering other layers of support But Black History Month is also, it's a time to look back, but it's also a time to reflect and celebrate Black excellence, Black joy. I know for some Black people, it's a history that's ingrained in the US, but there's also this joy that comes out of seeing achievements, seeing our Black patient advocates celebrated, not just in February, throughout the entirety of the year. And it's a really, I don't know, magical month, I think, for a lot of us. So I appreciate that we can talk about these discussions and figure out ways to continue to help not just Black patients, but all patients.
Well, one last fun question for you, Sarah, before you go. Are there any traditions you partake in during this month, restaurants you visit, special dishes you make? Yeah, we'd love to hear from you about that.
No, that's a fun question. It's funny, Tara and I were talking about that just last week. I'm like, hey, it's Black History Month. Like, I want to get some African food. And like, it's just simple things like that, like honoring and putting money towards like Black owned businesses, whether that's small Etsy shops or restaurants. Just being able to do that is a solid way to support the Black community who put so much love and energy into whether the outfits that they make, the jewelry that they make, the food that they make. And it's a way for me to stay connected to my culture. And it's a fun tradition that we started, and I love it.
That's fantastic. All right. Well, this has been great. Thank you so much, Sarah, for taking the time. There's a lot of work to be done, but it's great that we're working towards it. And like I said, if we were around in 50 years, I hope that we can look back and talk about the improvements, but certainly in shorter increments than that.
Thank you. Thank you, Stephen and Zoe, for having me on the podcast. And just one thing I wanted to mention in regards to what we're doing at GHLF for Black History Month is we have a page that's going up that was updated last year that's going to be updated also throughout the month. It's ghlf.org/Black-History-Month. And that's where you can find a lot of patient stories, a lot of articles, a lot of podcasts that are centering Black voices throughout the month and throughout the rest of the year.
And we'll put that in the show notes so everyone can find it. And if you're curious about any of the resources we mentioned during today's episode, check out the show notes. All the links will be there. But yeah, thank you, Sarah, so much for coming on and sharing your story and sharing the experiences of the community. Like you mentioned, it's not always easy to do so because it brings up a lot, but it's of course important to do so. So thank you so much.
Yeah, thank you.
Thank you.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating, write a review, and hit that subscribe button. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.